Health Check is sponsored by AllianceHealth Durant.
A torn anterior cruciate ligament, or ACL, is a common sports or work-related injury. It occurs more commonly in males and is frequently associated with football, basketball, and soccer injuries. It typically occurs when the foot is planted in the ground and a rotation force is placed across the knee. There are approximately 200,000 ACL cases per year in the United States. The ACL is the main stabilizing ligament in the knee. It controls the movement of the thigh over the lower leg. When the ACL is torn, the knee feels unstable to the patient, and it feels like the thigh is sliding forward. The treatment for a torn ACL varies from the conservative, which includes bracing and physical therapy, to the surgical repair. If increasing the strength of the quadriceps muscle, which is the main muscle on the front of your thigh, fails to stabilize the knee, then reconstructing the ACL is recommended. ACL reconstruction is a common outpatient surgery that has a long record of good results. The most current method of ACL reconstruction is a minimally invasive arthroscopic technique that involves 3 or 4 small incisions, each less than an inch in length. This allows the surgeon to rebuild the ACL from inside the knee. This minimally invasive technique, utilizing endo buttons to secure the graft, allows the patient to recover much more quickly. This allows them to return to sports and work with a stable knee. I'm Dr. Chris Leslie, orthopedic and sports medicine surgeon, AllianceHealth Durant.